Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.
And I'm Fred Goldstein with Accountable Health, here working with employer groups to help them and their employees improve their overall health and look at their benefits packages. So, I believe it was about a day ago, Nick, there was this sudden announcement by Pfizer that they were working on a third shot as a booster. And I believe people were wondering, is this what's going to happen with this? Is this thing real? And there was suddenly a response from our federal government. What was
I
that?
believe in the U.S. colloquialisms of sport, that would be called a softball. So, in an extraordinary piece of news, not only did we receive the fastest ever output and response to that piece of news, but we received it from three, count them, three. So it was the FDA, the CDC, and the NIH all came together and agreed. And I'm not sure that's ever happened. Maybe it has. I think a little bit unfair. And was it minutes? It certainly wasn't more than hours to say, no, you don't need it. We don't think that's necessary. We go based on science, I think was the word they used. So it was a pretty big slap to say, thanks, but we're not focusing our energies on boosters at this point.
So, what's sort of the bottom line thinking here? Was Pfizer saying, I think we have a need for this, we're going to start getting ready for it, and was not communicating that, you think, to the federal government? And what's the sense?
I don't know. I don't walk in these, fancy schmancy halls of power, and I'm trying to tease out from the tea leaves of social media. Um, I always start with the premise that there was not malintent. I mean, I
Mhm.
think everybody jumps over this and say, well, this is them trying to make money. It's this. I don't see any of that. I really think folks are really trying to find the best pathway to give us the most resistance. And sure, you give a booster, we get an even better response. And that was the interesting thing in the original data. Even with one dose, we saw effectiveness. Now, that effectiveness not quite as good when you look at some of these more transmissible variants, specifically the Delta, but it was still pretty good. And comparatively speaking, relative to the flu vaccine, it's a good, robust response. Do we need an additional booster? I don't think so. If we have that opportunity and people are willing, not a bad idea. I'm not going to run out and get one, but at some point, I'm probably going to find I might need one. And when it comes to some of the other vaccines, there's going to be some announcements, at least based on data. And I don't know what those announcements will say, yay or nay, but we may see some updates on that just gives you additional protection.
Right. And I think this also raises the question now. A lot of people are wondering, when are we going to get this full approval from the FDA for the Pfizer and Moderna vaccines and the others as well, obviously. But we keep hearing something about it, but who knows?
And obviously that's important because that changes the status a little bit. It's no longer this emergency use authorization. So hopefully they'll be able to focus and approach that problem. But I think viewers know that you're a Florida resident, and Florida seems to be something of a canary, I would say.
It might be, and it's interesting because as the virus levels have gone down the population and it's become less of a major news issue. So many of the states have stopped reporting as often or as frequently as they were in the past. And we've obviously seen now with Missouri that they've had some major issues with the Delta variant, we believe, creating outbreaks in that community, resulting in hospitals actually being full or running out of ventilators and needing to move patients. It's a difficult situation, which sort of reminds us of the fall. And now, Florida, which only reports once a week, has just released its latest COVID weekly situation report. And for the first time since April 30th, we're approaching those numbers of 23,697 people infected this past week. We were at a low of 11,400, so we've essentially doubled that in what looks like about 5 weeks. And the question then becomes, are we going to see an increase in hospitalizations 2, 3, 4 weeks out. Is this, in fact, the canary in the coal mine related to areas with lower vaccination levels? It's going to be interesting to watch this over time, but clearly the numbers for the past 4 weeks, 3 weeks, have been going up.
I think we need to watch closely, right?
Absolutely. And there are some other states that may be seeing something similar. So it's something to pay attention to. The curve doesn't look great. Obviously, we've got fairly substantial vaccination rates in certain communities. And in other communities, even as I look around the Jacksonville area, Jacksonville may be fairly high, but you look at some of the outlying counties and they're at 20%. And
It,
so, ripe for this kind of thing,
You've got to
unfortunately.
wonder why they moved to weekly. I don't understand the scale back. Was it that much of an impact in terms of reporting? Because obviously more frequent data allows you to react more quickly. It's a smaller incremental approach, but that's what we're living with. Um, uh, Talking about prevention and people's approach, some interesting news out of Belgium that we saw, right?
Yeah, interesting that we found it coming out of Belgium. They've decided to put in CO2 monitors into restaurants and other indoor facilities, gyms, etc., that are available for the individuals, clients coming in or the patrons to see the CO2 levels, which is an interesting thought because while it doesn't directly measure virus level or what might be transmitting in that room, it does give you a sense for how much clean air or how many people have been in there without the air being allowed to leave and be refreshed. So, an interesting approach. Apparently, it's not that expensive for these CO2 monitors, and they're going to mandate them in these facilities, give them about 3 months where they'll monitor it, and then if they achieve if they're over a certain level, they will fine the facility if they get too high.
And I'm just going to say they're not expensive yet. You remember the toilet paper incident from last year? Now that it's come, now
Quick, I'm going to Amazon. I'm gonna find me a bunch of CO2 meters to put up in my facility.
you fill your garage up. I think you'll be in great shape.
Hoard them. There we go. Just what we don't need to be doing. But I think it's fascinating to watch this. It's obviously not an exact science and doesn't directly relate, but there are some clear studies from a
Mm.
number of groups that have said this is an important measure of quality of the air, and some places do use it in schools already, just in general for their students. And as they said with this Belgium story, you can open the windows, open a door, those kinds of things to assist in getting more in there. And I know in the past you've talked about specific fan placement and things like that in some of the episodes.
Right, and certainly something we've seen in sports clubs. Another place where air circulation. It's a good proxy for ventilation and the inclusion of fresh air or more fresh air. So not a bad idea, but please don't go out and buy the place out.
Absolutely. Well, once again, another fantastic week talking with you, Nick. This is Fred Goldstein with Accountable Health. If you'd like more information about the work we're doing, you can go to accountablehealthllc.com.
And this is Dr. Nick. I'm the incrementalist here with incremental insights for better business, better health.